am a patient who's been admitted to the hospital unexpectedly. I am sick and weak, but more than that, I'm worried. I'm worried about what is wrong with me. I'm scared because I'm having pain and what that pain might mean. People I have never met before keep coming in and out of my room in all hours of the day and night and doing unpleasant things to my body. I feel helpless and very alone, which probably makes me less than polite and cheerful. I'm sorry for that. I think that you are talking to all of my doctors and that every doctor knows what medicines I'm on and what tests I've had and what the results of those tests have been. Just so you know, as my caregiver, I believe in you. I trust your experience and judgment and decisions for my health. Please, make the difference for me.
I care about safety and quality. Every time I enter a room or see a patient and family member in the hallway, I'm touching patients' lives, working with them to be engaged in their health care, helping them understand why they're in the hospital, partnering with them to care for themselves. Every day I remind them that it's okay to speak up. It's okay to let us know exactly what's on their mind. I promise to make a difference for safety across the board.
I promise to be as gentle and safe as possible. I promise to collect the correct patient's blood, put it in the correct tubes, label it appropriately, and transport it to the lab in a timely manner. Every day, I remind people it's okay to speak up. It's okay to let us know whatever is on their mind. I plan to make a difference for safety across the board.
I minimize the need for repeated exposure to X-rays. I assure that the radiologist gets a diagnostic image. I explain to the patient the what and why we're doing the X-ray. Every day I remind them that it's okay to speak up. It's okay to let us know whatever is on their mind. I promise to make a difference for safety across the board.
I want patients and families to experience a clean and safe environment when they're in my hospital. I walk into a room and patients and families tell me about their stay. I share this information with the team to make the patient's care better. Every day I remind them it's okay to speak up. It's okay to tell us what's on your mind. I promise to make a difference for safety across the board.
I listen to patients and their families. We're here as a team, working together, with the patient the most important member of that team. Along with other physicians and nurses, I will consult with patients and their families and include them all on this healthcare team. Every day I remind my patients it's okay to speak up. It's okay to let us know whatever is on their mind. I promise to make a difference for safety across the board.
What the patient eats and drinks is important in the healing process. I am here to help them manage their nutrition. It's important to prevent skin breakdown, keep the patient hydrated, and to help them feel better. Every day I remind them it's okay to speak up. It's okay to let us know whatever is on their mind. I promise to make a difference for safety across the board.
In American healthcare, we now realize that within the complex system of delivery of medical care, everything matters. To achieve the best expected outcomes for our patients, all caregivers involved must accept responsibility for performing their jobs the right way every time. We understand that our overall effort for the patient is only as good as the weakest link within the chain of care. You can make the difference for your patient. What patients want you to know. Patients trust their care staff, not only with their current condition, but also their entire lives going forward. The performance of your work or care can truly change every patient's outcome. You make the difference. Even though we may not get the chance to personally thank you, we think it. Thank you for caring for us to make the difference. This concludes Module 6, I Will Make the Difference in the Patient's Perspective series of Safety and Care. While this short video is not meant to be comprehensive in topic content, it is a snapshot reminder of patient concerns. Patient advocates contributed to the dialogue, highlighting the key takeaways that patients want you, as a caregiver, to know as they thank you for practicing safe and compassionate care going forward.